I mentioned the old incinerator at the now deserted Footscray Hospital. I'm pretty sure it was behind the emergency department. I have a memory of being taken to watch all the stuff get burnt. Hospitals don't have incinerators anymore, but they've still got waste, right? Let me take you through the numbers. At Western Health, 17.5 million gloves, 1.6 million masks, 2.1 million syringes, 135,000 gowns. That's 1 year. 2 million syringes, close to 2 million masks, 17.5 million gloves. Oh, my Lord. I'm just trying to think in my brain what that looks like. What do they do with it? If healthcare was a country, apparently, it would be the fifth largest carbon emitter on the planet. Let me introduce you to Professor Forbes McGain. Forbes is an anaesthetist and intensive care doctor at Western Health, trying to do something about this. Forbes, good morning.
Good morning, Raf. Thanks for the introduction. And I also just want to mention I have very fond memories of your dad, Joe Epstein, and working with him, looking after sick patients in intensive care. He referred them from the emergency department. So, yes. And I also have memories of that smelter. That's right.
So the incinerator was there, wasn't it? I'm not imagining that from my childhood.
Indeed, that's right. Yes, that's right.
Okay,
yes.
I'm glad, because I was kind of fascinated by it. Okay, I've left off one of your titles, actually, because you're an Associate Dean in Healthcare Sustainability at Melbourne Uni.
Yeah, that's right.
Can you do it better?
Yeah, look, I just want to mention the Lancet MedZero launched the World Health Assembly yesterday, and we at the University of Melbourne Western Health are very deeply involved in that, trying to provide good quality, high value care, but with less waste, both financially and environmentally. And we're very excited to launch this sort of multinational open access free website to the world, and it will allow clinicians and other people everywhere to access. You can all Google that now and look up the Lancet MedZero and start to work out what your real carbon footprint is.
So why does that help? Why is that going to make a difference?
Yeah, it's really interesting, Raf. So many people have been asking this for such a long period of time that, well, we sort of know how much things cost, but we don't really know what the carbon footprint is. And I think, if you don't know metrics, then it's very hard to make a change. And as you sort of alluded to there, like gloves were really big and syringes are big, like you've got to know all that data first before you can focus on the right things. So, metrics are really, really important, and it's a first step in making change.
Tell me a bit more about why you think it's the first step. I totally buy the idea that you need to measure something before you understand something, before you take action. But the only people who might look that up are the people who already care. Isn't the way to fix this make new people care?
Yeah, and I think when you say making new people care is a really good point, because we will see there will be more people engaged with this topic now that there's a free-to-access website that is globally relevant and will allow people who were not so engaged beforehand but now become into part of the fold. And also because you've got groups such as government, health departments, procurement officers, who will start to think, oh, okay, so it's not just a financial issue here. There's all these big things that are going on with the carbon and other environmental footprints as well. So there's a whole, it's not just the, let's just say the green doctors and nurses. It becomes much more than that,
Forbes McGain's an anaesthetist, doctor at Western Health, Associate Dean in Healthcare Sustainability at Melbourne Uni. Forbes, all of that stuff at the hospital, 2.1 million syringes a year, 17.5 million gloves. What happens to it right now?
Yeah, at the moment, it's either for things that are not infectious, in other words, not with blood contamination, that will go into landfill. So just like your normal landfill. Right. And if it is contaminated, at the moment in Victoria, most of Australia, it is sort of steam sterilised and then put into landfill anyway later on. So it's and we're running out of landfill spaces, and I think that's another really important point.
So how do you get? I mean, I realise it's not your decision. I guess in some ways it's a state government thing, but I don't really know who makes the decisions. How do you get that hospital to make a change?
And I think that's where we are making changes, but there's still a long way to go. So, for example, I would focus with gloves, for example. It's very much on, there are campaigns, the gloves are off, There are many situations where nurses, doctors, etc., don't need to be wearing masks. Don't need to be wearing gloves.
Oh, right. So people are already being encouraged to think twice before they use them.
Yeah, and I think there's a lot more we can do there. So there's no doubt there are campaigns underway, but working with infection prevention and others, this can be done safely. And I think there's a real opportunity there for further changes to reduce that markedly. We've seen some hospitals around the world, in a sense, reducing their glove use by at least a third. So there's quite exciting changes there. So that's what I'd focus on with gloves and syringes, because they're single-use items anyway. But then at the same time, you've got things like gowns and sterile drapes and things like that, which can be reusable. And it's still safe, providing high-value, good quality care. You could use a reusable gown 100 times. You wash it and steam sterilise it if required, if it's for the surgeon. And we do that at Western Health, and we're doing that for a while. And so it's almost like back to the future, back to the past, but also providing high-value care still for our patients. So we've got some fabulous surgeons and others who are deeply engaged with this process, Western Health, the University of Melbourne, making those changes.
Someone's texted saying they still throw away metal scissors. Is there do the metal implements get thrown away or reused?
Yeah, so if you're a surgeon operating, in the operating theatre, that will all be reusable metalware. But and when you get outside of the operating theatre, where everything isn't double counted, generally that's thrown away.
Thrown away.
So it is extraordinary, isn't it? There's something that will be dug out of the Pilbara as iron ore, sent to China, smelted, because that's where most of it is, and then sent to Pakistan. Interesting. That's a big world production of surgical metalware around the world, and then I'll use it once and throw it away.
That's insane.
So we don't throw it away at Western Health.
Okay.
We at least recycle it. But yeah, there is a whole story there about the effects of globalization and the cost of different things is important, as in financial
Mined
costs.
in the Pilbara, smelted in China, made in Pakistan, delivered to an Australian hospital, thrown away after 1 year.
Yeah, extraordinary, isn't it? We don't do that with our cars. Fascinating.
Well, the thing, I hope it's okay to link these two things together. I've been listening and reading about the Ebola outbreak in, is it Uganda, I think, in the Democratic Republic of the Congo.
Yeah.
They don't have enough gloves, masks, gowns. We're throwing them away. I mean, so it's kind of easy to draw those parallels. Is it easy to send the stuff from one place to another?
So I've got a great friend of mine who works at Western Health, also in Medical Pantry, Martin Nguyen. They are sending products to low and middle income countries, mainly the Pacific and Southeast Asia. Not so much Africa further away. It is tricky, as you know, the supply chains are difficult to somewhere like the Congo. But you're right, the inequality is quite extreme, isn't it, worldwide in healthcare. It's
just crazy. Forbes, thank you. Good luck.
Thank you very much for your time, Ralph, and thanks very much.
It's great to talk to you. Dr. Forbes McGain, anaesthetist, doctor at Western Health, Associate Dean in Healthcare Sustainability at the University of Melbourne.